some demographic groups are more at risk than others.
Yes, you're absolutely right. We know that the Ashkenazi Jewish population, for example, is increased risk for the BRCA gene mutation, and in the African American women, we know that they have a higher indication for the triple negative breast cancer, which is the most aggressive because we don't have any specific targeted therapy for it. And the younger you are, the higher the likelihood of perhaps having a genetic predisposition. So we will certainly send those patients for genetic testing as well.
And some women have such a high risk for breast cancer, they voluntarily have their breast removed before they're ever diagnosed. That's Angelina Jolie is the most highest profile example there. When she had that, many people were shocked that someone would take this extreme measure because there's always early detection. Why did she do it, and why is that a consideration to be done?
That's a very important question, Andrew, and that is because if you know that you have the genetic predisposition, then it's just a matter of when you're going to develop the breast cancer. And when it comes to breast cancer, at least as you alluded to, we can have earlier detection, and we know the patients will do really well. But in my opinion, as related to the BRCA mutation carriers, the most lethal of the two happens to be the ovarian, because we have no good way to really screen for ovarian cancer, and oftentimes the patients get diagnosed at later stages. So this is an active conversation, and not all the patients who have the genetic predisposition, the BRCA gene in this particular case, will develop the cancer necessarily. However, a lot of women want to take control once they know they have this genetic mutation so they have control of their life.